Hello everyone, and welcome to Chapter 13, entitled Respiration. This is the second part in Chapter 13. This is the pathophysiology of respiration. Alright, as we get started, factors that are necessary for optimal respiration include, the most obvious one is a patent airway. If our airway is not open, then how are we getting oxygen in and out? Next, for optimal respirations, we need to have an intact, functioning central nervous system. Remember, the central nervous system is what controls the respirations in the body. It controls the ventilations, and we can't have adequate respirations without ventilations. We need to have an intact chest wall, pleura, respiratory organs, respiratory muscles, and nerves that supply these muscles. Again, all help with ventilation. Sufficient number of functioning alveoli, because where does the respiration occur? The gas exchange physically occurs in the alveoli. We need to have open pulmonary vessels to assist with transporting oxygen, and an intact circulatory system and adequate cardiac output. Again, assist with transporting oxygen. Disruption in airway patency. Well, what can be some of our causes for disruption in airway patency? Have a loss of muscle tone, maybe from a central nervous system injury, or perhaps there's some other systemic cause. We can have a foreign body blocking the airway. We can have an infection, such as croup and epiglottitis, which are both childhood infections that can potentially cause partial or complete obstructions. We can have swelling from trauma or burns, hemorrhaging, which is what? That's right, bleeding. We can have excessive bleeding. An allergic reaction can cause laryngeal edema, which is edema or swelling of the larynx. And lastly, we can have trauma to the face or neck, again, causing swelling. Well, what can cause an interruption to nervous control? First, the thing that should come to your mind is a stroke. If we inhibit the functioning of our central nervous system, which, remember, if we go back to A&P, what our central nervous system is, our central nervous system consists of the brain and the spinal cord. Well, if we inhibit blood flow to the brain for whatever reason, then we are causing damage, and then that damage is going to stop the brain from controlling whatever part we damage. So if we specifically damage an area that controls respirations, well, there goes ventilations and respirations. A brain injury. We can have a TBI, which is a traumatic brain injury, from a vehicle collision, a fall, one of a dozen things. And we'll see this will be a very big problem. We'll have patients with head injuries, and our biggest concern, although they have this huge head injury and we need to immobilize and everything else, our biggest concern is going to be airway and breathing, because that's going to be throwing us off. And also drugs. Drugs can interrupt signals that are sent from the brain to the peripheral nerves, or to anywhere in the body. This can cause a major issue. Dysfunction of the thorax, nerves, or respiratory muscles. We can have muscular dystrophy, poliomyelitis, a spinal cord injury, or thoracic trauma. All these can inhibit our respiratory muscles from functioning properly. What are our respiratory muscles again? Well, we've got the diaphragm. We've got our intercostal muscles. We've got our sternocleidomastoid muscles. We've got our abdominal muscles. All of those play a role. Examples of conditions affecting alveolar function. Some conditions include emphysema, which is a form of COPD, which again is chronic obstructive pulmonary disease. This is all terminology you're going to need to become familiar with. Pulmonary edema, which is fluid in the lungs. Pneumonia, which is infection in the lungs. and asthma, which is bronchial constriction. And you can imagine how all these will play a role in affecting respiratory function. And then lastly, like we said, circulatory compromise, because if the blood can't get around, then we're not getting oxygen to the cells, to the tissues where it needs to go, and we're causing damage and causing hypoxia. Circulatory compromise can come from the pulmonary embolism, which is a blockage which is an emboli in somewhere in the lungs, and it's a clot. We can have a tension pneumothorax, which is a collapsed lung. Cardiac tamponade, which is where blood fills in the pericardial sac around the heart, and as it continues to fill, it starts to compress on the heart, and it stops the heart from having the ability to move and pump. Heart failure. Of course, heart failure, if the heart's not working properly, it can't pump blood throughout the body. Hypovolemic shock, which is lack of blood for whatever reason, either traumatic, where somebody's losing a lot of blood from an arterial bleed or a venous bleed, or it could be medical, maybe dehydration or diarrhea or some other cause, vomiting. And then cardiogenic shock. Cardiogenic shock is shock that affects the heart. Well, if we have something affecting the heart, we don't have the ability to pump blood, so we don't have the ability to transport oxygen and remove carbon dioxide. Alright, that is the end for section 2 of respiration, and this is pathophysiology of respiration.